You'll hear it now. Most of the time, the blood pressure pills that are prescribed are the ones that harm the body. Why is it done this way? Because they provide an effective symptomatic result. In other words, the blood pressure goes down, the symptom is removed, but at the cost of significant harm to the organs that are affected. The harm to the organs is considerable, but the symptomatic solution lowering blood pressure is fast and effective. And the doctor, thinking only about the present moment, doesn't consider the day after tomorrow, not even tomorrow, but the day after tomorrow, prescribes these methods of quickly lowering blood pressure without caring that this will negatively affect the functioning of organs in the future. This is the approach to treating hypertension that we have today. Unfortunately, this is the reality, and I am stating it openly. These are incorrect methods. But let's take a look at what exactly is being treated and how. Let's go from the top down. The standard in the treatment of hypertension is the use of prils. Well, that's captopril, enalapril, birlapril. What else do we have? Lisinopril. Everything ending with pril is an ACE inhibitor or an angiotensin-converting enzyme inhibitor, which shuts off the kidney's regulation of blood pressure. In other words, the kidneys regulate blood pressure depending on what they themselves need to function. That is, the kidney raises blood pressure for its own operation. The kidney itself increases blood pressure for its own functioning. And this is exactly what happens when you take a drug like enalapril. It shuts off this mechanism. As a result, the kidney can no longer function properly when taking enalapril. The kidney's concentration mechanism is immediately disabled. As a result, the kidney immediately produces a lot of urine. The urine is light, the urine is clear, which means the kidney is shut down, the kidney isn't working, and this will only make things worse for the kidney in the future. But enalapril and all these drugs, as well as there are also special medications from the sartan group, which are angiotensin II receptor antagonists. So it's basically the same story, but with an even more severe impact, specifically on the kidney. They shut down the kidney's ability to function. They shut down the kidney's ability to cleanse your blood. After taking these sartan drugs like valsartan, Valsacor, what else do we have? Vazar. So after these medications, the kidney will function even worse. And after several hours, 6, 8, even 12 hours, when the kidney finally gets rid of the effect of this drug, it kind of wants to start working again. And for that, angiotensin is released once more. The blood vessels constrict, the blood pressure rises, and we take another pill again. And this is the worst part, because we systematically prevent the kidney from functioning. And after just a couple of weeks of taking enalapril, a person becomes dependent on it like an addict, dependent on enalapril. In other words, the blood pressure rises essentially because the person simply stops taking the pills. A person becomes dependent on them. What do you need to understand? Very often diuretics are added to these prils as well. But it's not just furosemide, Lasix, and so on. Thiazide-type diuretics are also used as hydrochlorothiazide, thiazide diuretics. They are generally combined, enalapril with hydrochlorothiazide, our standard NAP, enalazid, and similar ones like captopril. I don't even want to list all these medications right now because each and every one of them has a destructive effect on the kidneys. Furosemide shuts down the kidney's ability to concentrate urine. It's a good drug for combating edema, but not for lowering blood pressure. It will lower blood pressure, and you can do that once, but if you use diuretics constantly, it leads a person to congestive heart failure. And that's a road to nowhere. It's the final path. When a person is already being prescribed diuretics, this comes from medical practice. It means that over the next 6 months, the person is being prepared for death. That's exactly how, as I said, they prepare someone for death. In other words, so that at least in the last 6 months of life, the person can live without swelling. But because of the same furosemide, the kidneys work even worse and worse and worse. And that's why there will be significant harm in the future. You shouldn't take either sartans or ACE inhibitors. You shouldn't take diuretics. This is not a treatment option for hypertension. So let's go horizontally from left to right. Sometimes to lower blood pressure, they prescribe either beta blockers. These are bisoprolol, well, formerly atenolol, metoprolol, bisoprolol, and everything else ending in lol. And calcium antagonists, these are corimfar and amlodipine. Nifedipine, formerly known as Corimfar, and nifedipine, then amlodipine. There are also drops called farmadipine. So the principle is that anything ending in dipine will always match, and that's how you recognize your medications. By the way, let me just say, do you want to know the medication you're being treated with? Don't read the brand name, don't pay attention to what it's called. Look in the quotation marks under the name for the active ingredient. The trade name is just something the pharmaceutical company came up with. It doesn't mean anything. What you need to look at is what's inside. There's an active ingredient, use that to determine what you're actually being treated with. What is bisoprolol? It's a medication that acts on the heart's adrenoceptors, and because of this, it slows down the heart, stops the heart. What does that mean? It means that bisoprolol is actually a good medication for treating tachycardia, rapid heart beats, as well as certain forms of atrial fibrillation. In other words, it's used for atrial fibrillation and irregular heart rhythm that is also fast. And bisoprolol is effective specifically for treating the heart, especially for arrhythmic disorders of the heart. Someday I will definitely make a video, even a whole series of videos about the heart. I'll tell you how to treat it properly, because in many cases it's treated incorrectly. But this aspect of bisoprolol is not very good for people who already have heart problems. The same goes for congestive phenomena in the heart and also for left ventricular hypertrophy. That's not very good. If this is also accompanied by tachycardic forms, then it might still be acceptable. But if there is normal systole, normal cardia that is, a normal heartbeat and taking these medications can actually lead to a weakening of the heart rhythm and cause a person to go into heart block, to develop bradycardia, specifically a block. This can worsen certain forms of arrhythmia. I repeat, this is in the case of left ventricular hypertrophy. Therefore, taking such medications solely to lower blood pressure, especially considering that you may not fully know what kind of problem or condition you have with your heart, is dangerous, unnecessary, and not advisable. Moreover, it will not have such a strong effect on hypertension. It acts exclusively through the heart and also through the adrenergic receptors of the blood vessels. But this is not the option you need for providing emergency care. Amlodipine is a milder drug, a calcium channel blocker that primarily affects the heart as well, lowering blood pressure through the heart by blocking calcium channels and reducing the heart's contractile ability. In other words, amlodipine lowers blood pressure by acting through the heart, specifically reducing cardiac pressure. It's more logical, more appropriate. But the thing is, amlodipine, while it can be used to treat arrhythmia, can also provoke arrhythmia and, again, trigger heart failure. It's not always rational to use it when there are signs of congestion in the heart, specifically in the vascular system. And that's why amlodipine is also one of those medications that isn't always rational to use for lowering blood pressure. There's also farmadipine, the same farmadipine. You put a few drops on bread, eat it, and your blood pressure goes down. Yes, it works through the heart. But what's wrong with these medications? They don't actually address the root problem, which is that the kidneys are what caused the high blood pressure in the first place. So we're lowering blood pressure through the heart, but in essence, we're not solving the kidney problem. That's why these medications, whether for the heart or for the kidneys, aren't entirely appropriate for lowering blood pressure, especially if it needs to be done immediately, right then and there. Huh? So a question for Dr. Golod. Well, what should you take? What should you do? Guys, you need to understand that regardless of what caused the high blood pressure, whatever factor triggered it, the very essence of the pathogenesis of the disease of high blood pressure is vascular spasm. In any disease, you can generally consider etiological factors, pathogenetic factors, and symptoms. In this case, the symptom is elevated blood pressure. The cause most often is the underperformance of the kidneys. But pathogenetically, high blood pressure is still a spasm of the blood vessels, a vascular spasm. The vessels, the smooth muscle layer of the vascular wall, are in spasm. And if you want to act correctly and not harm the kidneys or the heart, you need to target the spasmed blood vessels. And the way to act on spasmed blood vessels is attention antispasmodics. This includes the same debazola myotropic antispasmodic. It's also the same papaverine and the same platyphyllene. Excuse me, but euphyllene is also an antispasmodic for our bronchopulmonary system. Antispasmodics are, well, an old familiar friend of Dr. clonidine. Well, not the same as clonidine, which we are used to, but that is exactly how it is used. It is a vasodilator. And once Though it was a long time ago, you probably don't even remember this clonidine was even used as a treatment, not for hypertension itself, but for hypertensive crises. What do these drugs do? They have a vasodilating effect. A vasodilating effect, there were even little pills called popazole, I remember. What does it do? It provides a short-term temporary effect directly on the muscular wall of the blood vessels, causing hypertension, everyone to become more relaxed for a brief period of time, but as a result, it effectively lowers blood pressure in the body. Is it interesting to consider whether this could cause any harm to the kidneys or the heart? The answer is no, it does not. Does it solve the problem for a person with high blood pressure? Yes, it does. So what's the catch? The catch is that it only solves the problem for a short period of time. If these pills can lower blood pressure for 8, 10, or even 12 hours, then taking the same kind of vasodilator, well, let's be honest, a shot of magnesium sulfate intramuscularly, and that's it. And the blood pressure will go down. It's simply a vasodilating effect. But this effect is short-lived. This effect does work, but it doesn't actually solve the problem. Vasodilators and antispasmodics produce this effect, but it won't last long well because it's not supposed to. When I work on lowering blood pressure, my main goal is to solve the problem right now, to eliminate the symptoms by acting on the pathogenic process, and to do so without harming the heart or kidneys. But when it comes to treating hypertension, guys, treating hypertension means involving the kidneys. And involving the kidneys comes down to just 2 or 3 simple factors. The first factor, you need to drink enough water. So please, if you want to avoid hypertension, drink water. The second and third factors are warming up the kidneys and warming up the feet. Warming up the kidneys helps ensure good blood flow to them so the kidneys can start purifying it. Warming up the feet is important because when your feet are cold, the kidneys simply don't function properly. And for that, you need a turmanium mat like this one. But keep in mind, using a turmanium mat to warm up your kidneys and feet is not a solution for a hypertensive crisis. It's a solution for hypertension itself. It's a treatment for hypertension. In other words, it's about preventing your blood pressure from rising in the future. It's important to understand that the solution for a hypertensive crisis is vasodilator drugs and antispasmodics. Like back in the day, when grandma had high blood pressure, they gave her a shot of clonidine, her blood pressure dropped, and everything seemed fine. But of course, it will go up again in a few hours. The root cause hasn't been addressed. Isn't that right, guys? That's why you should never confuse emergency care with treatment. Emergency care means vasodilators and antispasmodics. They will relieve the symptoms, but only for a short time. But after that, nothing changes. You need to get up and start systematically treating your kidneys, treating your hypertension, so that your kidneys stop causing your high blood pressure. Unfortunately, modern medicine doesn't work this way. By destroying either the kidneys or the heart, it simply addresses the problem. A person takes pills for high blood pressure, but unfortunately, this harms their health.